Our job as nurses is to make ourselves not needed. And by that, I mean patients need to have autonomy in the way they care for themselves and in the way they manage illness. And we just need to step in when they need support or education or additional resources. We want to teach our patients to be able to manage their whole life, including their medical issues, whether it means managing their wellness and increasing their wellness with things like exercise and dietary changes and lifestyle changes, or whether it means managing a specific illness and getting as much wellness out of that as they can, whether that's a chronic illness like diabetes or high blood pressure. We want to teach patients to take their own lives into their hands and be able to manage their own care. It's our jobs to resource them in that. Today, we're going to be talking about the concept of self-management. We'll be talking about the concept of self-management from Giddens, chapter 7. As usual, you're going to be completing your concept study guide. You're going to define the concept of self-management and be able to describe it in your own terms. You're going to recognize levels of self-management, identify some theoretical links that underpin the concept of self-management, and then talk about the role of interrelated concepts to self-management. So what is the definition of self-management? Well, it's the ability of an individual or their caretaker, if they have a caretaker, to engage in the daily tasks needed to maintain wellness and health, or to be able to manage any illnesses that they may have, whether it's physical or psychological or behavioral. And so that's based on and they're able to do that based on their understanding of their disease or condition, its consequences if not managed appropriately, and the plan of care that's been put together by their healthcare team. And so just like adherence, there's different levels or spectrum of self-management. And just like adherence, it can go from complete, perfect, optimal self-management to an absence of self-management or anything in between. And it can change. It's not a fixed point for any one patient. And it's influenced by a lot of different variables in someone's life. Here are the attributes and criteria for self-management. So self-efficacy is someone's confidence in their own ability to manage their care. So some patients are more confident in this ability to either maintain their wellness or manage their illness than others. So when I was pregnant with my second child, I was diagnosed with gestational diabetes. So diabetes related specifically to pregnancy that went away after I wasn't pregnant anymore. And I had to go to a nutritionist and see a diabetes specialist to teach how to self-manage my illness while I was pregnant. I felt very confident in my ability as a nurse to be able to manage my own illness. And so I had a lot of self-efficacy, a lot of confidence in my ability. Patient engagement. How well can we partner with our patients and get them engaged with taking control of their own health and their own self-management? Health education. A patient can't manage something if they don't know what it is or how to treat it. And so we as nurses do so much education and teaching to make sure patients understand. The patient-provider partnership. Having a trusting relationship with your healthcare providers and the people who are giving you healthcare treatment and plans of care is vital to a patient being able to self-manage. And then finally, disease management, which is, self-management plays into how well a disease is managed in a specific patient, because that self-management is one component, and then there's always the healthcare team management when we come into the hospital and we manage them ourselves. And so one component of that is the self-management that plays into the greater idea of their disease management. So let's talk a little bit about the theoretical links that are going to underpin self-management. So the social cognitive theory identifies that patients it's kind of like the little engine that could, I think I can. So the patient who really thinks they can manage their illness and self-manage, is probably going to be able to do that. And those who think, oh gosh, I couldn't possibly give myself insulin injections at home, that's too scary and I won't be able to do that. They're probably not going to be able to do that. So how we think can definitely impact our ability to self-manage. And similarly to that, the cognitive behavioral theory, which is what you're seeing here in the graphic, talks about this connection between thoughts and feelings and behavior, and how thoughts can influence feelings and feelings can influence behavior, and then that circle continues to go. And so if we have positive thoughts about our ability to self-manage, we're going to feel like we can actually do it, and then we're going to do it. And so we want to make sure we're encouraging and empowering our patients to be able to feel like they can really manage their care at home. And sometimes there's different hurdles we have to get over in order for them to feel empowered and that they can actually do this. And so it's, you know, if they have to give injections to themselves at home, it's making sure that they feel comfortable with the education and with them returning the demonstration and making sure that they feel confident with their ability. And making sure that if we're sending a patient home on hospice, for example, with a loved one to take care of them, making sure that they have all the things that they need at home, whether it's oxygen or a hospital bed, so that they feel like they've got everything they need to be able to self-manage or manage the care of their loved one. So we want to empower them through education and resourcing so that they can feel like they can do this, and then they will. And this doesn't have to actually be as big as a patient coming home on hospice or a patient giving themselves insulin at home. It can be something really small, like recommending a pill sorter. So my mom comes over once a month now with my dad, and all three of us sort a month's worth of her pills because she takes pills 4 times a day. And we put them in this pill sorter, and now she feels like she can manage her own care at home because she could see if she took it or not. And she, along with my dad, make sure that they remember to take her medications. And now she's got this great self-management, and all it took was a couple pill sorters from Amazon to empower my mom to have the resources she needed to be able to self-manage her medications at home. So there's 4 areas that we are going to be focusing on for our patients in terms of self-management. We want to teach them to manage their life or their health in these 4 areas. Their health enhancement and wellness, so things like going to the gym or eating more fruits and vegetables. Pre-disease or disease prevention, so preventing disease in the first place. Teaching them how to manage a new disease. This is especially pertinent with things like diabetes, when patients are going to be learning how to give insulin shots at home or check their blood sugars at home. Or it could be a patient with hypertension, high blood pressure, teaching them how to check their blood pressure at home. That's all disease related from a new diagnosis. And it can also be acute event management, something that happens in the short term. For example, when I had my gallbladder out, we had to learn how to manage my incisions after this surgery. And that was just an acute event to make sure that I, had good wound care for my incisions after surgery. And so how do we focus on self-management? Well, we do a lot of education. We talk a lot about preventive health measures, ways that we can keep patients healthy. And then we certainly always focus on the patient as being the center of our care and making sure that we respect the patient's wishes and desires and what they want to get out of their health. So what interrelated concepts are involved when we're talking about the concept of self-management? Well, certainly patient education and then adherence, because of the adherence and self-management go hand in hand. Their ability to adhere, their belief if they want to adhere, and then their self-management is like that ability to do so. Health disparities, patients who lack a proper medication or lack proper access to healthcare are going to have a hard time self-managing. Collaboration, both interprofessional with nurses and physicians and respiratory therapists and all of us getting together to help teach the patients to self-manage. Care coordination, making sure that the patient has all of the right resources available in terms of therapies, phlebotomy, nursing, physician, pharmacy. Making sure those are all aligned so the patients have everything that they need to be able to manage their disease or their wellness. And then health promotion. So we want to not only help them manage their diseases, but promote health and prevent disease to begin with. Here are the exemplars that your book talks about, things like prenatal care and different things that we ask moms to look for at home. Asthma patients and teaching them to use their inhalers and follow their asthma treatment plan. Type 2 diabetics, making sure that they're checking their blood sugars. HIV and AIDS patients who are connected to places like the Core Center downtown, where they can make sure that they have holistic care and that someone's watching them constantly to have the best optimal wellness that they can. Heart failure, we have to teach patients to do things like daily weights at home to monitor their fluid overload. And then depression, we teach patients to monitor how bad their depression is that day and when to seek help and what their help is. We also teach them how to, focus on activities of daily living and on things that are going to continue to help boost their mental health. So we want patients to adhere to the treatment plans that we as healthcare workers offer to our patients. And we want to teach them to do it with self-efficacy, their ability to own their own life and take responsibility for their own healthcare and feel empowered and confident to do that. And we do that by educating them and resourcing them and making sure that our plans and all of our recommendations are patient-centered and align with what the patient wants for their own health outcome. I hope this was helpful. I'll see you soon.